Now I kindly re-invite for the second session, low handling high potential solutions through homeopathy. I would like to invite the speakers of the session, Mr. Dangayat sir, Mr. Veeramani, Mr. Subesh Singh and Dr. Praveen Kumar sir to take the honorable stage in the dais. And I would like to invite the first speaker, Subhash Singh sir. And I would like to invite the first speaker, Mr. S.P. Dangayat sir, to share the valuable knowledge about this topic. Thank you.
Thank you. Homeopathy now. I would like to enumerate 5 of them. First of all, we are now noticing that there is substantial action in the field of nanosciences. Nanotechnology is super nano. For the simple reason that nano goes up to 1 upon 10 raised to 9, whereas biochemic goes easily up to 1 upon 10 raised to 12, or homeopathy goes up to 1 upon 10 raised to 60 or upon 10 raised to 400. Nanoscience is throwing up solutions, and I'm very glad to know and learn and tell all of you that in homeopathic preparations, in biochemic preparations, there are clearly signs of nanoparticles being present. Nanomedicines in the other fields are doing wonders, and I think this is a time when biochemic and homeopathy together can carry out rational research all the work to show to the world that homeopathy was far ahead and homeopathy is being understood partly. The second thing is that homeopathy is super green. In the current times, we are talking about climate change, global warming, and all other ills that are associated with that. Homeopathy, as a matter of fact, is a super green medicinal system. Third, the thing that we are noticing is that the policy makers and others all over the world have started realizing that surgery, diagnostics, and vaccination are not exactly allopathy. Diagnostics and surgery, both of them are independent of medicinal science. As a matter of fact, medical devices industry has been clamoring and demanding that they be treated differently than the food or the drugs. We had done a round table on the meaning of evidence, science and approvals some 2 years back. An interesting thing that came out was that every single system has its own pluses and minuses. Allopathy or biomedical system cannot claim that it is only scientific system. And I'm glad to tell you that now we are able to see that homeopathy can also be established scientifically with double-blind, randomized control and all other kinds of the trials, keeping scientific principles and scientific approach behind homeopathy in mind. Fourth, or the fifth, the thing that we are finding is that all medicinal sciences are sure to get suitable recognition from Government of India. We had Dr. Khurana ji telling us about what the Government of India is planning to do, and I am sure that if we also put in hard work, we also cooperate with the Government of India, we will be able to show that homeopathy is also scientific in its own way. So the magic of less is more. Homeopathy means less is more. The magic of this particular kind of a paradigm and kind of thinking means there are all kinds of opportunities that are going to come up very well. I would like to take only 5 because there are 20 or 30 or 40 low hanging fruits. But the first one is the biochemic. In the field of homeopathy, I am finding that biochemic is still very much underrated. Biochemic certainly is not homeopathic in the classical way, but the fact is that biochemic is a very simple branch of the current homeopathic practice and has got many potential applications. Veterinary and agro is the second one. Veterinary use of homeopathy is very well established. As a matter of fact, if homeopathy is working on the veterinary side, it is working on the animals and giving evidences for the cure or the treatment, it obviously means that it is going to be suitable. It is scientifically proven to be suitable for human beings. To use, successful use of homeopathy in veterinary means we have got huge opportunities that are going to be available to us. Homeopathy is wonderful for OTC. Over-the-counter drugs is going to be the future. Even the allopathic world is thinking that there should be a lot of trust and a lot of support to the OTC. And that is where homeopathy can certainly do wonders. Delivery of homeopathic medicines in innovative ways is something which is being seen all over the world. I was there in the US last week, and I must tell you that an oral spray for cold, cough and throat is available through many companies in homeopathy. It makes the delivery of homeopathic medicines very easy. The fourth opportunity, low-hanging fruit, is going to be in respect of rational, affordable and safe clinical trials. The missing link in homeopathy is the clinical trials, and that is what we have been hearing from everybody. I personally think that it's a business that can be built. There can be business built around rational, affordable and safe trials, clinical trials of homeopathy. Fifth, important thing, which is going to open up the opportunity is when we change our paradigm from bringing about a total cure to management. In allopathy, as we know very well, today, bulk of the business in medicines is coming from lifestyle management or lifestyle disease management. It could be diabetes, it could be the cardiac, it could be maybe the hypertension or maybe things associated with that. Everywhere it's a management. If homeopathy also starts thinking, if homeopathic companies, homeopathic practitioners start thinking of the management, it is going to open up a very big opportunity. So we have got immense opportunity through homeopathy for treatment, cure as well as management. Treatment has got two parts, cure and management, both are there. The question is, how do we now succeed in doing whatever we can see? And I personally would like to again look at five things which can be done. The first is that we have to enhance the skills of the students and the practitioners. How do we enhance the skills? The skills are to be enhanced by imparting them some tools, some better courses, some better kinds of maybe knowledges, and this can be very well done in the college, in the homeopathic colleges. You are all here looking at the opportunity after you pass out. You can definitely enhance your opportunities. You can enhance your scope of work by learning some of the things which are going to be appropriate. It could be with regard to the hospital management, it could be with regard to data management, it could be with regard to the data sciences, it could be also every practitioner is a micro-entrepreneur, and therefore it is essential for the doctors also to train themselves to behave as entrepreneurs and learn the necessary things. I believe that this particular bunch of colleges here can engage with the management schools or entrepreneurial schools and then try to have some kind of offline, online courses that can improve the employment and entrepreneurship opportunities. The third thing is to emphasize and to carry out suitable amount of research. As a matter of fact, that is something which is being missed out. We are stuck with whatever we have seen in the conventional, in the traditional or the classical books. We have to evolve. The knowledge, science, everything is evolving continuously, and therefore we need to see what are the kinds of things that can be done through homeopathic science. Look at isopathy, for example. Look at toto-homeopathy. Look at, say, things which are going to be development of nosodes in the modern way, not, in the classical way alone. Can we develop nosodes? Can we develop, say, autologous vaccines? Can we develop some such thing and build the businesses around, them? The fourth thing is that homeopathic world has been very difficult. In my opinion, we have got to be assertive, we have got to be firm, and we have to carry out our advocacy in a proper way. So these are the kinds of the five things which should be done. In conclusion, I would like to say that this is a time for all of us to work very diligently, very intelligently, and obviously strategically. We just can't think that people will develop the business for us. We are all in the business world. Homeopathic, the companies, homeopathic doctors, homeopathic colleges, homeopathic institutions, all of us have to look at evolution and development of business. If that particular mindset is created, that particular maybe change is brought about, I personally see a very, very bright future for homeopathy. India, as Khuranaji was saying, India is a place which is leading in the field of homeopathy all over the world. We can, say, we can bank upon that, we can certainly leverage that by putting in hard work, intelligent work, and certainly building practices or businesses which could be in a manner that it benefits us. We create the wealth for our own selves, we create the wealth for everybody who's there in homeopathic education, research, or business, and then we also benefit the society. The whole world is looking to solutions which are going to be green, which are going to be maybe holistic, which are going to be the long term, which are going to be sustainable, and I think homeopathy is genuinely and honestly the medicine of the future. I wish all of the people who have come here all the very best. We have to go on working in a manner that is befitting the potential and kind of scope for homeopathy. Thank you very much.
We would like to call up National Institute of Homeopathy, Calcutta, Chief Editor of Homeopathic Quarterly Journal, named as National Homeopathic Recorder. Please, sir.
Thank you very much. In the morning, I was looking at this clock going. So I asked the organizer, what is this clock supposed to mean? Means after 0, we have to start speaking. Because I am an organ teacher, So, for pickup start, it needs more than 10 minutes. Well, our respect and gratitude to Master Hanneman. I think we all will agree to this, that homeopathy, having all said and done, is comparatively a very easy system of medicine to practice. It doesn't need very much of intelligence. If you have any doubt about it, look at my face and face of your teachers. I don't think any intelligence is required. What is required then? As I said earlier, what that homeopathic system is facing today is not from outside. Because the outside system was already there when Hanneman was there. People were criticizing, people were opposing, all these things were already there. The problem today that we are facing is from inside. There are different approaches, there are different methods, different schools, everybody claiming I am successful. And we all know there can be only one correct method. So what should be the correct method? Sometimes in order to be sounding more modern and different, because you have to be different nowadays. If everybody is calling father as father, so you have to be different and you should call your father as mother. Then only you will be different. So my dear friends, the only way to survive today is by sticking to the basics. Now don't judge the organ of medicine by the way examinations are held. I am also a teacher, I am also examiner, so I know why the is written in capital and why this is in italics. That is not organon is all about. Organon is something much more than that. Organon gives answers to many of the questions which any practitioner who thinks of practicing homeopathy faces daily. I will give one or two instances. There was a lady, she was a homeopath and she was facing so much of problem. So she went to this doctor and she went to that doctor and everybody prescribed the medicine. She herself was a doctor, she also took a medicine. Then ultimately, at that time, Dr. Kent was a very famous personality. So she went to Dr. Kent and asked, sir, I am so and so. This is all my problem. What should I do? After listening to the problem, and I am sure you are also, when you start practice, you will also face this. So Kent said, since when you have been taking lachesis? Now that young lady, doctor, was shocked because she has not narrated this part except that she has told the whole case, history, everything, but she has not said that I have been taking lachesis. So she asked Kent, sir, to whoever doctor I went, they said lachesis and I took lachesis. So Kent said, you are not suffering from any disease as of now, you are suffering from lachesis overdose or lachesis poisoning. Whatever are symptoms are symptoms because of lachesis. Now how does Kent know this? There is another instance. You may have heard of Dr. H.D. H.D. was an allopath doctor initially, a very famous doctor of Germany. And he had a fall. He fell down, there was an accident, and after that his left side of the body started to become severely painful. This side was drooping and it was becoming thinner and thinner and thinner. He was not able to do his work. So at that time, whatever allopathic medicine and methods was there, he was taking all those. And then nothing was working, it was getting worse and worse. So he heard that there is a new doctor called Hahnemann, he has started a new system, and at that time WhatsApp was not there. Letter was usually supposed to be written, so he wrote a letter to Dr. H.D. narrating all his complaint that I had a fall and after this is the suffering I am having, and he himself was a renowned doctor. By return letter, tell me, was there any history of skin disease earlier which have not been treated properly and which went away because suppression he would not have understood. So he said, did it go very suddenly? Now this guy, Dr. H.D. was shocked because he at that time, about 10 years back, he had joined army. And when he joined army, he was suffering from some skin problems. So he was going in train to join the army. He has to get down because of this skin problem, took some local medicine, get well within 2-3 days, and then continued. So he asked, he narrated the whole thing to Kent, send him 5 powders, pudiyas. So he took first, nothing happened, second, nothing happened, third, nothing happened, fourth, nothing happened, and he was just thinking that those who are criticizing homeopathy, they were right. So he took the 5th one, and then symptoms started going well. And within a very short time, everything was well. So H.D. went to meet Hahnemann and asked him, why have you asked me skin disease? How did you know that I had suffered from this skin disease? Now the answer to this is very simple, but simple for those who know homeopathy. Because there has to be a cause and effect relationship. His history of fall can be a cause of some injury, some pain, but cannot be a cause of this severe systemic problem. For that, there has to be some involvement of miasm, sora, fundamental cause. And in order to know that, he had asked whether there is any suppression of skin disease. So this, very often in practice we get these opportunities that we give medicine, doesn't happen, we give medicine, doesn't happen, and at one point of time we think, I should have tried for NEET exam once more time. But we don't think that all diseases, how to treat, all system, all protocols are there in organon. What is required, somebody has to just read it. Let me tell you of a case before this hooter comes. There was a patient who came to a young doctor like you. Doctor, I am suffering from constipation. You asked, because you asked about thirst. The patient says, sir, my thirst is for large quantities of cold water at long interval. Now you start thinking whether the patient has read Allen's keynote and came. Because he is talking in the language of Allen's keynote, but sometimes, doctors are lucky. And you have already been unlucky when you were giving NEET exam. So maybe this time you are lucky. So you ask further and you get this acceleration by complete. So you think what better way you can have, fulfilling everything, symptom, case, three-legged stool, whatever your teacher has taught, whatever your book you have read has taught. Don't clap, because clapping means sometimes is misguiding. Clapping means I can think that you like my lecture and I can go on. Organizers will be in trouble. So, you prescribe Bryony alba. Higher the sibyllum, higher the potency, so moderately high potency you prescribe, single dose, because true Hahnemann, and nothing happened. So you take up the case again. You say, yes, it is again Bryony only. So nothing happened. Now can anybody tell me what is wrong? There is no obstacle to cure. In order to suggest, you have to read this aphorism, where it is said that medicine like Ignatia, Bryonia, Belladonna, they have alternating action, so one dose may not work, and when they do not work and still indicated, the second dose has to be given. Now who will tell you this? And don't tell me you are not going to face these problems in your practice. My intention was to go on telling like this. The instances where your knowledge of organon, which is very much overlooked because of many reasons, mostly because of the teachers that we have, including me. But it is overlooked, neglected, it's a fact. I will conclude by this small case. There was a lady, thin, lean, thin, menopausal age. She was talking continuously, and when she came to my clinic, she was talking very howlessly and very abusive. And I asked her, when did all happen? So it happened since yesterday. She has some alcohol in a party, and after that all these things has appeared. So you take the history, and you, after taking history, you give the medicine. The symptoms were indicated, so you give the medicine. Alzheimer's, because symptoms were of Alzheimer's. And medicine, as homeopathy works, it worked like magic. Next day, all symptoms gone. So you came to Chennai in GHF seminar and presented the case. Ki homeopathy, see, my clinic, it works magic. I gave one dose and every symptom was gone. And when you go back, then after 15 days or 1 month, it was asked, when you took the history, then the lady said, the relative said, ki again there was a party, she was well, so there was alcohol. So she has not been taking during this period, but she was alcohol, so she took a one sip. And then she remembered, no, this has caused problems, so she dropped it. And after that, the whole thing has started. So you thought, okay, no problem. Again, the same medicine is indicated. You gave Alzheimer's, nothing worked. You again gave Alzheimer's, nothing worked. You again gave some other medicine, nothing worked. Now, what is the problem here? Again, I am telling you, there is no obstacle. The problem is written in aphorism 221. That after the first dose of medicine which has relieved the problem, what was required was that some antipsychotic treatment was required so that recurrence do not happen. The patient antipsychotic treatment was given, and this has caused the problem. Well, as Dr. Praveen is looking at me very angrily, let me come to the last slide and just want to emphasize that there are problems that we face in our clinic. And these problems, most of the solutions are already known to us, but we are just not aware of it. What is required from you is first your decision that I will do homeopathy, as homeopathy should be done. And second, if you face problem, don't run away, don't leave, rather try to find a solution.
Chief Managing Director of Fortis Laboratories Private Limited. He currently serves as the chairman of the Tamil Nadu Pharmaceutical Science Welfare Trust, which offers scholarships to farm students. He's won a Lifetime Achievement Award from the Dr. MGR University, Chennai. The stage is yours, sir.
So, respected organizers, particularly Mr. Shivang Swaminarayan, who has called me here, and Dr. Jayesh Chopsi, and so many other dignitaries and homeopaths here. So, I think, I am not a homeopath. Neither I am a practitioner nor a researcher of homeopathy. But probably, I have been invited here because, probably since I am dealing my company, I am market side actually. Which one? Okay, right. So one thing is, homeopathy, a lot has been discussed from today morning and all, but it is the one which has stood the test of time for more than 200 years, and second largest system of medicine, next only to allopathy, and practiced in 80 countries. Globally, over 200 million people are using homeopathy on regular basis. In developed countries, the prevalence of homeopathy use has increased now from 1.7% to 4.4%. This is all the information coming from various 11 countries where the research was done, right from USA to Singapore. And Indian homeopathic market, leads to a number of people using homeopathy in the world. Homeopathy is high conventional pharma products, and 82% of the users are not inclined to switch to conventional form of medicine. So those who have started using homeopathy product, they are not switching over to other products. They can stick with this homeopathy only. And as a matter of fact, 100 million people solely depend on homeopathy in India. And homeopathic market is growing because I can, as a marketing person, I can say that growing at 20 to 25%. Of course, it is now going to touch 1.2. The chairman of Pharmaxil and also past president of IDMA, saying that it's around $50 billion US, and now, of course, growth rate has come down to 8 to 10% now. The potential of homeopathy over allopathy has been that it prevents, cures, and promotes holistic health and well-being. That cannot be said about allopathy. And there is a low-hanging fruit they have been talking about. These are the therapies where we found that there is a therapy gap with respect to allopathy. These are the areas where allopathy is not able to provide a cure or this thing, lasting relief. That is thyroidism, hyperthyroidism, allergic diseases, chronic respiratory diseases, chronic sinusitis, liver diseases, PCOD, infertility, renal stones, gum diseases, arthritis, hair loss. In these markets, EP 13 study where, they have studied that select conditions and all that the homeopathy is really, excellent, and there are 2-fold to 4-fold lower usage of conventional medicines when in these conditions like musculoskeletal disorders, sleep disorders, anxiety, depression, and upper respiratory tract infections. So safe for prevention, of course, already today morning also we were discussing about during COVID-19 how the arsenicum album was used, as an adjuvant and as a preventive. Higher scope for OTC sales, and even OTC is allowed to be, even homeopathic medicines are allowed to be sold even in allopathic pharmacies. So this OTC sales scope is high. And this is my thing. I can talk because I am in both. I only feel that homeopathy should become complementary to allopathic medicines. In the other countries like in Europe, in France, Germany, and all, the homeopathic and allopathic coexist. They go together. Even in manufacturing, I found somebody in Germany manufacturing homeopathic medicine, the same facility where allopathic medicine has been formed. So it is important to integrate all the therapies and create a life-saving module for the entire humanity. Because what I am saying to say that when we have such beautiful therapies and relief and all, why should you segregate a separate system of medicine? Why don't you integrate both allopathy and homeopathy for the betterment of the individual, betterment of the patient, betterment of the individual, for the well-being? It can be done. And homeopathy can be a part of the career. I am talking very extreme, but I think I can do it. In the sense, I am not a government, I am not in the government or other things. Homeopathy can be a part of curriculum for allopathic doctors. There is a discussion that for one month you can have this thing, the allopaths can have 1 month this thing in extra exposure to homeopathic medicine. But this is just a thought. But something has to be done, and allopathic doctors can be allowed to prescribe homeopathic medicines. In the same way, the other way also, homeopathic doctors can prescribe allopathic. So, if there is a curriculum which is integrated, then both can happen. Then this can enlarge the scope for both the medicines, but particularly bring homeopathy in the forefront. So challenges of homeopathy is that the pharmacopoeia standards, I think that Swaminarayan, he will also agree there that there is pharmacopoeia, there is a Indian homeopathic pharmacopoeia, German pharmacopoeia, US pharmacopoeia, but there should be some sort of harmonization in the pharmacopoeia standards. So particularly, when we want to go to drug regulatory authorities for licensing and all, we have a problem. Like, which homeopathy, which pharmacopoeia it comes to. Even it can be very good if we can, there's harmony there, which will even help in the exports of homeopathic products from India. And more number of homeopathic manufacturers can come in by harmonization and simplification and also review of the applications. And if this is done, it definitely will open up big way availability of evidence also is important. I think again today there has been discussion about evidence-based medicines. More amount of evidence has to be created and that they have to be recorded also. And the way forward is that robust research, of course today morning also we had a lot of discussion about research being done there. And only thing is that the treatment, they should, the researchers should continue and they should publish their treatment outcomes. As these publications document clinical effectiveness of beyond doubt about the mode of action. So that's the important thing that is required. And homeopathy will play a key role as far as I am concerned in wellness goals of India. Many chronic diseases can be cured with the help of homeopathy. What we lack are proper research and methodological presentation and documentation of successful cases. I even say that government also should fund. Government funding to support research will be very valuable for homeopathy. So I would only conclude by saying that the medicine needs homeopathy. Not the homeopathy requires medicine. Medicine needs homeopathy for a holistic and very comprehensive healthcare. Thank you. Jai Ho.
Thank you, sir, for sharing your knowledge. Now, we would like to invite our favorite doctor, Praveen Kumar, sir. He is a renowned international speaker, well known for his attributions in academic and clinical explanations. Mic is yours, sir.
All of you must be cursing in your minds, I know very well. Open. Hey Bhagavan. Subhash, you did something. He is my deadliest enemy. He would have done that. Okay. Now, good afternoon, dear friends. I won't take much time, only 1 hour. Okay. Now, we have done an in vitro research on MDR TB organism with the help of Dr. Chitra Chandrasekhar, who presented in the morning. She is a microbiologist, research-oriented PhD scholar as well. And I am fortunate to be close to her. She is our patient, family friend, close friend, everything. Wasting time. Okay. Now, kahan yaar? Which one? Okay. So, we will talk about hanging, what is low hanging and high profitable, that solution which we have from homeopathy. The buzzword now and the greatest threat to the whole humanity and especially allopathic fraternity is antimicrobial resistance. They are finding it difficult. So we have a better answer. We can show them the way. We can help them. As I said in the morning, like no system is a panacea. We don't have answer for every damn thing. But we can help them. So that we can do, like antimicrobials, antibiotics, antivirals, antifungals, antiparasites. All these things. If there are no effective antimicrobials, so modern medicine is very difficult to survive. And we all know we have 2 types of response to a stimulus, fight or flight. Either we have to fight or we have to flight. So this fight, even the microorganisms would take up this issue and they would fight when they have entered into a body. And when you have not tackled properly, what happens most of the times, I am not blaming allopathic medicines, they are the best, fantastic. Now when once a person is being prescribed with antibiotic to be taken for 5 days, and this man, what happens most of the times, goes to the medical shop and tells, give me for 2 days. I'll check whether it goes well with me or not. Not only that reason, but also the reason that if he feels better, he won't take another 3 days. And non-compliance is one of the commonest reasons for this. So this also adds fuel to the fire, and microbials would develop resistance. So they fight and they develop resistance and they don't want to succumb to any medicine. This is the problem which you will be seeing all over the world, and we are seeing it now. And Chennai is the place where there is one society to which Dr. Abdul Ghaffur is the leading president or some designation. He would come in the afternoon also. Please wait for his lecture. And so they are trying to see the answer. So when we have showed him, the other day he was in Ahmedabad as well. We told him, we have an answer. So that's what he opened up the doors and he said, let us do the research together. That we can, we would. So what is the problem? The microbial organisms, they mutate. When they mutate, they become stronger and they will not be having the same structure which would be amenable to that particular antibiotic treatment. So this antibiotic treatment would become waste because these organisms would become intrinsically resistant. So as per British Medical Journal, 75% of antibiotics use is of questionable value. So that overusage, unnecessary usage, abuse and non-compliance and so many other genetic factors as well would help the organisms to develop AMR, antimicrobial resistance. So this increases the risk of disease spread, severe illness and death. If the antibiotic doesn't work, what they do? They give the second antibiotic. And when they give the second antibiotic, it also doesn't work. Now we will be seeing in many cases, not only just MDR TB, even in HIV cases, even in typhoid. I had quite a few typhoid cases where they were resistant to chloramphenicol, they were resistant to ciprofloxacin, they were common antibiotics, they were not listening to it. But it was proved, it was positive. And even malaria, chloroquine, primaquine resistant malaria cases were plenty. They don't listen to that particular anti-filarial drug, anti-parasitic remedy, which was hitherto working well. Really, this clock is dangerous. I was enjoying earlier, now I am feeling thrust. Okay, there are 32 antibiotics which are very important for priority pathogens. Now, those antibiotics are also becoming like shortage. And this is a global health problem. AMR is a big menace, big difficult problem. And WHO has declared that AMR is one of the top 10 global health threats humanity is facing. Top 10. Okay, misuse and overuse, as I already said, lack of clean water and sanitation, inadequate infection prevention and control. So it promotes the spread. Members of society in a daycare centers. This is very obvious because this is a country where we have plenty of humanity. The cost of AMR to the economy is significant. When the person cannot get better in 3 days, 5 days after first usage of antibiotic, we will lose man hours, which is very important for the economy, and that person also will become ineffective later. So bacteria, drug resistance is very important. There are and all other types of things. Ciprofloxacin was not becoming effective in UTI, which was earlier. And then TB, which is very important. In fact, Dr. Chitra's main field of performance is in MDR TB, finding the resistance and all that. Okay, so resistant to two most powerful anti-TB drugs, that organism, and it does not listen to them. So they will go to the second line of drugs, which will be difficult, and then only 1/3 of the approximately 500,000 people who developed MDR TB were detected and reported. This is the greatest problem. Diagnosis, as Chitra was telling in the morning, is the greatest lacuna. And only less than 60% are successfully treated, MDR TB people. Estimated 3.4% of new TB cases and 18% of previously treated cases had MDR TB. The TB which was hitherto diagnosed, 18% of them, okay, is a form of TB that is resistant to 2 or more drugs. So obviously homeopathy is the answer. So we wanted to do an in vitro research. So we wanted to show the efficacy of homeo medicines in MDR TB, and we have taken the help of Dr. Chitra Chandrasekhar. She has taken strain of H37RV, and in National Institute of Tuberculosis, Bangalore, she has done this in vitro research. We have selected at random 3 important drugs which are very useful in home treatment of tuberculosis: Pulsatilla, Drosera, tuberculinum, and in LJ medium. And slope method, these cultures were grown and there was no growth in anything except Pulsatilla 6, and of course there was no growth even in control. Control was containing neutral alcohol. So that causes little concern. So we wanted to go for suspension method. This is another elevated method of in vitro culture method, in which we have taken all the same dilutions and they were exposed to, and 28 days of incubation, that was earlier minimum, and later on she waited even for later days as well, and all the rest of the dishes had the growth of MDR-TB, including the control, except tuberculinum 30. So what do we infer? Tuberculinum 30 has got the greatest capacity to inhibit the growth of MDR-TB. So we have put it into our clinical practice also. As a sample, we have taken 20 cases of MDR-TB and tuberculinum 30 was given, and in that, except in 6 cases, 14 cases, there was tremendous improvement. She used to follow up them frequently. Wait a minute. So, and AFB reports were also followed, culture was also followed, and 3 cases died, 3 cases discontinued, and unfortunately one homeopathic doctor from Belgaum, young girl, she died with MDR-TB. You may remember Chitra. So tuberculinum 30 is either in vitro or in vivo, is very, very useful in MDR-TB. And similarly in HIV, many drugs, we have done that in vitro research on Crotalus horridus 30, that is very, very efficacious, and most of you may be aware, we have got that specialty clinic now under the control of CCRH in our JSPS Hyderabad. More than 57,000 patients are registered there for HIV treatment. In our clinic itself, we have got more than 2,500 cases. Many cases are reporting very much improvement in terms of CD4, viral load, and many cases have also shown seroconversion, but it is still a long way to go. So it is a complex problem. AMR, united multi-sectoral approach, is very essential. Thank you very much.